my body temperature had also gone down from, it used to always run like 99 point something. Well, it's now 96 point something. Um, Unless I have some type of viral infection or infection, then it's normally 97 or 98. If I get overheated, it can get all the way up to 102, which could be 104 for all I know, since my body temperature runs, low. But other symptom I have is I have small fiber neuropathy in my lower extremities, my legs, but I only feel it in my right leg. I have stinging, burning, numbness, pain, which is very hard to explain to somebody, how you can feel pain when your foot is numb. But if you've never had it, you can't explain it, because part of your foot may be numb, but going up the side of your leg, it's stinging and burning. And then the ankle can be very painful. And there's also a compression feeling, like your foot doesn't want anything touching it. That they cannot explain why I only feel it so much on my right side. I've had a lot of injuries on my right side, which some of my friends have said that they think they know what it is. There's just too many. There's too many things. There's too many different. So anyway, after I started seeing him, my symptoms started getting worse. So he wanted me to try home health therapy, IV saline therapy. So I did that. Let's see. You're going to see me referencing things. I did the home health therapy April of last year, which is 2013. I started on the 24th and did it until May 8th. And it was supposed to be every other day. And it was a liter of just saline solution, so salt water, and it was to try to help me stay hydrated. And what they do is they put the IV in, so it stays in your arm. So the nurse would come out, put it in. She got the machine going, stayed with me. The first time for maybe 30 minutes. Within a half an hour of her leaving, I got an error message that it had a downward occlusion. So I did not get the IV therapy that night because I couldn't fix it. The next night, she came out, checked the vein, showed me again. And these take 4 hours. They had it set on a 4-hour drip. So I was getting home at like 6 or 7 o'clock at night and trying to eat and love on my little cat Tony over here for a little bit before settling in on this couch back here for 4 hours to try to do this IV infusion before I had to go to bed and get up at 4 o'clock in the morning to be at work by 7. And I'll explain that later. I don't want to make this set. I think, let's see, I had 1, 2, 3, 4, 5, 6, 7. I think out of the maybe 12 times that they either came out to set up a new IV because there was a problem with it, it got clogged. I couldn't unclog it because I had to clean it myself. Every morning and every night I had to put the heparin in it and the saline, cover it up so nobody would see it at work, because I didn't want to have to explain that. I think out of all those times, I was able to actually get an IV therapy session 5 times. So I had so many problems with the IV not staying in, and coming out because I have small veins, and POTS patients typically have problems with this. They either recommend putting in a PICC line or a port. So not even a month after I was diagnosed with this, they were talking to me about putting in a port, which is surgery where they would implant this square looking box under my chest here where they could connect IVs. They could give me shots if they needed to, whatever. Or a PICC line, which I had already been told not to do because they're prone to infections, and worse. I told them that I couldn't tell one way or the other if this had been beneficial because it had been so stressful. Because almost every time I had tried to do an infusion had been a problem. It had gotten either clogged, or the nurse would have to come out and fix something. I had to pull them out most of the time myself, and I have pictures which I will post on the website of my arm showing the one time the nurse had put the IV in upside down, and I'll put a picture of what they look like, and you'll see why it did what it did to my arm. And when I told them that she had put it in upside down, it has like a butterfly thing on it. They told me that that was impossible, that she couldn't have put it in upside down. Well, it is possible because it did happen. So, within less than 2 weeks after my last IV session, I ended up in the emergency room because I was severely dehydrated, and I had a horrible migraine and a lot of other symptoms, stomach symptoms, and I was dizzy, feeling faint, and my electrolyte balance was off. They had to give me potassium liquid form in the emergency room, and I've been on a prescription of potassium and sodium chloride since then. I have to drink at least, I drink about a gallon of water a day, so I have to be very careful to make sure that I take my potassium, magnesium, calcium, sodium, because with the Florinef, if you don't get enough salt, it starts taking from your potassium, and then it goes to the next mineral. So evidently when I stopped the IVs, that's what happened. Right after that, I was referred to a doctor here locally, and I had autonomic neuropathy testing done because a lot of the symptoms that I have had to do more with how my organs and my nerves were functioning. So I went to this doctor, had the autonomic testing done, and the tilt table test done. The tilt table test came back abnormal. My heart rate did not do what it's supposed to do when I went in an upright position. And the QSART test, they both showed that I have autonomic neuropathy, which again is, it affects how your organs in your body function, how the nerves in your body, they send signals to your organs. They're not sending the right signals to my organs. And then the small nerves in my legs. I don't have large fiber neuropathy, but I have small fiber neuropathy. So I was diagnosed with that in June.